Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. Okay, we are back for the last segment.
Last segment, Pahrump.
Yeah. Gary's on the phone. Gary.
Yes, sir. I was just listening to you, okay? I have a bad back. I've been taking oxycodone, Oxycontin, and morphine for like 22 years with the Veterans Administration. At one time, for a lot of years, I was getting 240 pills, okay, on different pills. Now, they got me down to 180 pills today with the VA, right? And plus I have, let's see, Oxycontin, I got 180 pills, and the morphine, I got like 25.
Uh-huh.
Now, what I can't understand, the next thing I can't understand is where you cannot smoke on the premises of the hospital, right?
Smoke cigarettes?
Yeah.
Okay.
Now, on the VA end of it, on their property, they have like a little intercove building where you could smoke in. Now, that's another thing I can't understand with the government, where they preach to the civilian hospitals not to smoke around there. And also, like you're talking about, just so many pills that you can get, right? But the government's giving me 180-some pills on one end of it and morphine on another end of it. Now, when they try to cut me down today more, I told the doctor this. I might be wrong what I'm going to say. You're going to make a bad man, or you're going to make a good man into a bad man. Now, what do? Get drunk? Buy it on the street? Or do I get drunk? You see what I mean?
Yep. And this is the big push, Gary, from a lot of these government agencies to start working in these different clinic situations and trying to cut people down gradually. There are no limits to what you can take, but there are a lot of limits to what you can get filled in the local pharmacies and what the government is doing. The problem is that even though we consume 80% of the world's opioid, it makes a small population. So there's not a big political bloc that can go in and call their senators and tell them, you know, this is uncruel, this is not fair, this is not right. I mean, this is what I've been taking, this is what I should be taking, I'm being monitored. I go to a doctor, and you're right, it forces a desperate behavior, and desperate people do desperate things.
They go to heroin.
Yeah, or they'll go to buy it on the streets, which only goes to say, how does it get on the streets? Well, there's some people that come in and don't have the pain, but then they need the money, and so they come in and they get their pills, and they may keep a few for themselves, but they may, you know, sell them to someone else, and that's unfortunate, but it does get into the wrong hands. So, you know, those people are a real problem, but how do you sift through those, right? And before we went into this problem, Gary, I know the Scorpion Task Force was buying about $80,000 a month in opioid prescriptions on the street.
Wow.
Okay. and this was several years ago. So that's a lot of diversion. That's a lot of product that should be in the hands of the correct people being distributed for people that want to get high and just want to get loaded. And it is unfortunate, and I think the truth of the matter is that, you know, patients who have chronic pain should not be treated with acute pain medication. I have a lot of my patients that are on short-acting opioids, and I tell them, I can't, this is not right. You have chronic pain. Why am I going to give you a medication that's going to wear off in 4 hours when you have pain all day long?
Yep.
I mean, there's a lot of science to pain management, and our whole thinking from a medical standpoint does have to switch from just giving out indiscriminate amount of pills, just like antibiotics. You know, how many antibiotics did I write last month? I don't know, but it was probably a lot. But now you have to really be thinking about all of the opioids. How many opioids did I write last month? That's a really big number, you know, and so I really have to watch that, and I have to tell people, we have to cut you back a little bit at a time.
But now to interrupt you, right, the only time them pain pills work for me, okay, is when I lay down in bed during the day, stop working, and then when it feels better, I go back to work again. Then I have to go back in bed again to lay down, and that's the only time they work. They don't work as you're working. You see what I mean?
Right.
So now, like I say, I've been on to it 22 years. That's an awful lot of years involved with a lot of this here medicine. Now, if they think that they're going to cut somebody off, they can't. It's impossible.
I agree. You have a huge tolerance. You've built that up over time.
You see. But now, on the next thing is, I'm going to talk about that VA clinic of ours down here in Pahrump. Now, I looked in New Jersey. They have a brand new clinic there. They do minor surgeries there. And I think they're open up 12 hours a day in New Jersey, in Vineland, New Jersey. Here at this clinic here, you can't even get an x-ray done there. And I can't understand it with the government putting money into this down here when it's worthless. Because all you can get is a needle, get blood pressure tests, your blood tests, and stuff like that. All minor stuff. But this is worthless, this clinic down here. Okay, well, look, I had enough time on here, okay?
Well,
but I hope the government, with the doctors, because it should be up to the doctors only, not the government getting involved with the doctors. Okay? Okay, bye-bye.
No,
Thanks, Gary.
You know, it should be that way, and it really should. It should be basically a Jeffersonian. It should be an independent thing. I mean, you've got to practice, but not everybody practices correct in that respect.
Therein probably lies the problem. I think with this new regime, though, that they're trying to pull the government out of it as much as possible, and,
right.
And maybe, hopefully, Gary,
Big
that'll
Brother,
help
yeah.
you.
And I've said this before: a government big enough to give you everything you want is also big enough to take away everything you love. So, you know, I think that, and it's unfortunate being a veteran, in the sense that if you go to the Veterans Administration for your health care, you know, it is a very big government agency, and they're, you know, someone says something up above, and we got to do something about that because it's politically correct, and then it passes down, and you, the poor patient, goes into your VA provider, and he says, I can't give you this.
But with Gary, from what I'm hearing, 22 years, they gave him the medication so that he would just, would just go away. He wouldn't complain.
Exactly right.
Now they're taking it away from him, and he's going to complain.
Right, and it's what you call a little bit of due diligence, trying to reduce the amount that of opioids on a low nature. Meaning, listen, the pain is the same for the most part. It's coming off of the medication when you're on that high of a tolerance causes as much pain as the pain you were treating 20 years ago. That's what people have lost sight of. Okay, and that's why you do need it. It's not going to take away all the pain. Let's get down to what the realistic approach is that opioids are meant for visceral pain. What is visceral pain? That is organ and gut pain, okay? So, but because it relieves pain, they'll use it for somatic
Bone,
pain.
joint.
Yeah, that's somatic pain.
Yeah,
That's musculoskeletal pain. Well, it's not really indicated for that, but people use it for that.
Because it works.
Well, it does.
Up to a point.
But the anti-inflammatories, the mobility side of what we've talked about,
Yeah.
what he said is it hurts, I can get up and I can go work, and then I lay down, and he's got degenerative joint disease. By nature, is just as good with Tylenol and maybe a little bit of ibuprofen and heat stimulation, massage, keep things
And
loose.
exercise and restoring function.
And then you take opioids, and then you rest, and you get quiet, and then your body, kind of gels, and then the next thing you know, you got to break those joints apart because you're going to get moving, and that's very painful. So I think it's realistic that opioids really just aren't the panacea, but they've been used so much that now it's trying to undo that problem, and it's very, very difficult. I mean, but it takes an effort, and it takes someone who wants to take someone like that, Gary, and reduce him slowly. I've heard other physicians in this town, they walk in and say, I'm just cutting you in half, or I'm not going to prescribe that anymore. Well, that's just cruel.
Yeah, I agree with you.
That's
I agree with
not
you.
right at all. I don't care. And if your doctor had come in there and said, I'm going to cut your pills in half, time to find another doctor. That's what I'm going to say. Okay?
I can't disagree with that.
Yeah. I
at all,
mean,
Mike.
you can do a small percentage here and there. You can have that discussion with the patient and say, listen, we all need to do something to thwart a little bit this. And I mean, I can't keep, patients should take a drug holiday. If they have good days, they should try and eliminate some of their own pills.
But I'm back to Gary again. 22 years. If it took him 24 months to taper down,
Oh, yeah, that's
then
exactly
it
right.
takes him 24 months
Yeah,
to
it
taper
could take
down.
several
you
years.
don't cut him in half.
Right.
You don't just cut him in half.
No, but I'm just saying,
Because
if
he's
you
panicking
are...
when
yeah.
you do that. He's panicking.
Right, no. And anxiety leads to increased pain. But if you're out there and you're a consumer and your doctor walks in and all of a sudden he's had a bad experience with some patient going rogue or whatever, and then they just come in and they want to arbitrarily cut you down to half of your pills, that ought to be a light bulb. It's just, go find somebody else. That's just not fair. I mean, unless he knows something that you're abusing them or you're selling them or your urine screen didn't show up, I mean, that may be a different story. But if you're really taking the medications like prescribed and they just want to come in there and arbitrarily cut you in half, I'd look for somebody else. That's cruel. And that's not doing anybody any good at all.
Nope.
Not very good at all. So, well, we're almost out of time.
Another good show tonight, Pahrump.
Yeah.
We really appreciate your input. We love your calls. Thank you, Ray. Thank you, Chuck.
Yeah.
Thank you, Gary.
Yeah, thank you, Sandra, for calling in. I appreciate that. I know it takes a little guts to pick up the phone, but trust us, nobody's going to make you feel stupid for calling in. So y'all have a good night.
Good night, Pahrump.
We'll see you next week.